Hi, everyone. MPP Jeremy Roberts here, and I'm delighted today to be joined by special guest, Dr. Tyson Graber. Dr. Graber is an associate research scientist at CHEO's Research Institute right here in Ottawa. And we're going to be talking to Dr. Graber a little bit about an exciting project that they've been working on at CHEO, looking at COVID levels in the wastewater. So, Dr. Graber, I wonder if you could just start by outlining a little bit what this project is and where the idea came from.
Thanks for having me, Jeremy. Yeah, so this project really started back in April when 2020 hit us, and it started because somebody called up from the University of Ottawa and asked whether we had any experience in SARS-CoV virus, and unfortunately, everybody was closed down. The research labs were closed down. Luckily, CHEO was able to open up their labs, and we were able to collaborate on this project. And so the project is basically to identify the SARS-CoV-2 virus in the population's wastewater. So when we excrete every day, when we fecally shed every day, what comes out is fragments of this virus. And so it's not necessarily infectious, so you're not going to get infected through the wastewater with virus. However, there's pieces of the virus, so pieces of the RNA, pieces of the genome of the virus that we can actually detect in wastewater. And so in Ottawa, over 90% of the population, all of that wastewater goes into one central facility. And so we're collecting that every 4 hours of the day over a 24-hour period, and then looking with a molecular assay or molecular test at the pieces of those genes in the virus. And so we can actually measure how much of that virus, not only identify that this virus is in this population in Ottawa, but we can measure it. And we're doing this on a daily basis now. We've been doing this for almost a year, so since April. So we get a really good idea of the prevalence of this virus, or at least the RNA from this virus in the population as a whole.
For sure. And what has the data been telling us lately? I know there was some media coverage the other day. The president of CHEO, Alex Munter, put out a tweet showing that levels were rising in the past week or so. Can you tell us a little bit what the data's been showing us recently?
Yeah, so unfortunately, it continues to go up, the wastewater signal, and this correlates well with what we're seeing with individual cases and with hospital censuses. So these three pieces of data, so the wastewater data in Ottawa, the individual cases, so the swab tests that are positive every day, and together with the people going to hospital, reporting to hospital with COVID-19, these three key elements of data are being fed into Ottawa Public Health on a daily basis now, and it's together with the epidemiology team and Dr. Etches, the medical officer of health, and their associates. They take all of this data and decide, how they should implement their public health measures in Ottawa. And so this component, this wastewater component, is actually surprisingly, and which is great, another metric, an independent measure that is being used on a daily basis by Ottawa Public Health to gauge the prevalence of infection in the community.
Well, and there's so many different pieces of data that people sort of focus on, and I think it's good for folks to know that this is one of those metrics out there that our health officials are looking at, and so would you generally say that these numbers that are coming out of the wastewater monitoring are a good, sometimes early indicator of where some of those other numbers are going to go?
Yeah, so this was one of the early hopes of another reason why this project was started, is because it was thought to have been, a very good early warning detector. And so some of the earliest data coming from out of Holland, out of the Netherlands in Europe, showed that, this was actually, the wastewater data was actually a leading indicator, meaning that it would actually show up in wastewater. The viral signal would show up in wastewater maybe 2 days, even a week before they started seeing people going to get tested and getting positive tests. So Ottawa is not the only group, working on this around the world. multiple groups in the US, multiple groups in Europe. And all of these scientists are all working together, and it's really a great community right now in this field. We're all working together to be able to figure out, what is happening and how much of the lead time, how much information, how soon the information can get out to public health officials. And right now, the consensus is, and the Ottawa data also shows this, is that the wastewater data leads by possibly 2 days, and it's really dependent on how good the individual swab testing is in the community. So right now, we have a very good testing regimen here. It's not the best, but it works very well. And so we have a very little lead time. So if we see that signal going up in wastewater, Ottawa Health knows. And maybe 2 days later, we start seeing a jump in cases. And then hospital data is very much a lagging indicator here. So it takes a week or two before people start going to hospital with COVID-19. So we'd like to think that wastewater is a leading indicator for sure. Swab testing comes next in terms of indicating what's happening in the community. And finally, the hospital census data kind of concludes all that, or is another piece of data that tells you for sure, this is what's happening in COVID-19 in the community. And so far, the wastewater data completely follows what's happening with swab testing and with hospital data. So we see increase in signal in wastewater, which is what is happening right now. Thankfully, not a huge increase. It's steadily going up, but not at a high, with a high peak. And then, a few days later, we start seeing increases in individual swab testing positivity. And so right now, Ottawa unfortunately has a very high positivity rate. So we're at, I think, about 5%, 4 or 5%, which is a little scary. And then, unfortunately, we're probably going to see in the next week or very, very soon, hospital inpatient COVID-19 data going up as well.
That's really fantastic information, and really valuable, I think, for folks out here in the community to understand what some of those metrics are that we're looking at. So thank you so much for sharing that, Dr. Graber, and thank you so much to you and all of your team over at CHEO for the phenomenal work that you're doing on this project, and to help us be better armed with data as we combat this COVID-19 pandemic.
Thank you. Stay safe.